So my study was the POUT trial, which is looking at perioperative chemotherapy compared with surveillance in completely resected upper tract urothelial cancer. And the reason to do this study is there's a real dearth of any evidence in this setting. This is the largest phase 3 randomised study ever in this patient group. And the problem with this is that it's a niche group of patients. In the UK, there's about 1,400 new cases of upper tract urothelial cancer every year diagnosed. The standard treatment is a nephroureterectomy, but what happens after that is very uncertain. There's no international standard about whether you should have surveillance or chemotherapy. And we know that this type of cancer tends to be chemosensitive in metastatic disease, but there's never been any study done before. And that was the rationale behind the study, to try and look at an international standard. And the study randomised patients within 90 days of their nephroureterectomy to either 4 cycles of chemotherapy, platinum-based, or to surveillance. And the chemotherapy, everybody got gemcitabine on day 1 and day 8, and then patients got either cisplatin or carboplatin based on their renal function, on their GFR on day 1. And so the only reason to give carboplatin was based on renal function. If patients weren't fit enough for cisplatin otherwise, then they weren't allowed to go into the study. And the cut-off rates for that was using a GFR of greater than 50 for cisplatin and then 30 to 49 for carboplatin. And we had planned to get 361 patients into the study. However, the study was shut prematurely because the data monitoring committee met and said we'd met our primary endpoint, which was disease-free survival. And at that point, we had 261 patients from centres right across the UK. The UK really got together and delivered on this study with all the urologists and the oncologists across the UK in 71 different centres. And the study is a positive study. It's a strongly positive study for the benefit of adjuvant chemotherapy. The results show that in 2 years, 71% of patients who'd had chemotherapy were free of cancer, compared with 54% in the surveillance arm. And that was strongly statistically significant, with a hazard ratio of 0.49. And the same results were true for metastasis-free survival. So again, in the chemotherapy arm, very strong effect. 74% of patients were free of metastases at 2 years in the chemotherapy arm, compared with 60% in the surveillance arm. So again, very statistically significant study. We have got some very early data on overall survival, but at the moment we can't apply any statistical constraints to that because it's still very early and we're collecting overall survival data. So this really sets an international standard from this UK-based, UK-delivered study of changing practice internationally to look at giving to a maximum of 4 cycles of platinum-based chemotherapy to these patients with T2 to T4, N0 to N3, completely resected urothelial upper tract CC. So when we look at side effects, we collected side effect data until the end of cycle 4, so that was 12 weeks of treatment, and we looked at chemotherapy toxicity, but we also collected at the same time points side effects in the surveillance arm. And so in those 12 weeks, the chemotherapy toxicity for grade 3 was about 53%. Now, it's a chemotherapy study, so you can see side effects, and they were nothing different to what we would expect. It was a neutropenic rate of about 25 to 35%, a neutropenic sepsis rate of between 5 and 7.8%, but no neutropenic deaths, nausea and vomiting, and low platelet count. And I think the big thing to say is when we look at the age population of these patients, 80% of patients were over the age of 70. 40%, over the age of 60, 40% were over the age of 70, and 5% were over 80. And so for an adjuvant chemotherapy study, giving chemotherapy to a maximum of 4 cycles with very manageable toxicity, nothing different to what we would expect, it shows that it's safe and well tolerated. And in terms of the number of cycles we could get in, 71.8% of patients who had chemotherapy, we got the full 4 cycles in. So we showed that we can deliver it safely for something that's going to improve their survival. There are 2 things there. First of all, when we started the study, we did look for international collaboration, and for a variety of reasons, nothing to do with not trying very hard, it didn't happen. I think every country has its own different funding mechanisms and different issues. But what we're doing at the moment is looking for a successor study to POUT, and we'll definitely be looking for international collaboration with that. The biggest success of this is pulling together all of the urologists, all of the oncologists across the UK really got behind this study. I extensively promoted it from the time that we first had the first concept to the time when we recruited the first patient. So it is really a triumph of something where it's a niche number of patients, where you've really got to try and get potentially every eligible patient possible into the study. So it really is a triumph of everybody coming behind the study.